Welcome to Girl Talk here at Bajaj Plastic Surgery. It's about to get real. This is super real. I'm here with Dr. Anu Bajaj, board certified plastic surgeon here in Oklahoma City. I'm Connie, in case you are just meeting us. Welcome. Today's topic for this episode, buzzwords. Buzzwords, they kind of drive us crazy, but we also want to be like cool. Right? Yeah. I feel like when you stop trying to grow and do things and it just makes you feel old. So, okay, we can catch on. That's fine.
Yeah, but I think there's more to life. But what buzzwords do you want to talk about?
I do want to talk about some buzzwords, which is interesting because when you started talking about preservation techniques and how it's not even a new thing, I think that's where the buzzword stuff gets interesting.
So, right, there's a lot of things that people do to sound new and cool, but they're also adaptations, right? And one of the hot topics today, or in today's world, is preservation breast augmentation. And it goes off of other things that people are using preservation for, right? To assume that they're maintaining your normal anatomy. Like preservation rhinoplasty, preservation deep plane facelift.
Is preservation technique really new?
So in terms of a breast augmentation, what the concept of what they're referring to as preservation breast augmentation is anything that doesn't violate the pectoralis muscle. Okay. So for a long time, for the past several years, people have been calling preservation breast augmentation a subfascial or subglandular augmentation, right? Because they're not violating the pectoralis muscle. Right. The newest way that preservation breast augmentation is coming up is with the patented Preserve technique by Motiva, where Motiva, a breast implant manufacturer, has a specific device and that allows for what they say is a minimally invasive breast augmentation, which can be performed under local. And I would argue that most of this is not new. For example, when I was a resident in the 90s, one of the surgeons that I worked with and that we did our cosmetic surgery rotation with, did all of his breast augmentations in his office under local with IV sedation.
Like not even in an operating room?
Well, he had an office.
Like a procedure room.
A procedure room.
Huh.
And that's what he did. So doing a breast augmentation under local is not new. And all of the augmentations he did were on top of the muscle. So he did not violate the pectoralis muscle. So that's in and of itself is not new.
Right. And the preservation technique, just kind of talk to me a little bit about how you would do that in a face.
So what they're referring to, and I read this article last week, is minimal undermining. So you're doing a deep plane facelift, but you're not undermining the entire neck, which means separating the skin from the underlying layer. And so that's what they're referring to as preservation.
So how do I know, or how does any patient know what they need? If they're looking at social media and they're like, oh, I see this preservation breast aug or a preservation face, I need that, or my friend had that. How does the patient know what they need?
The patient isn't the surgeon. I mean, let's just be honest.
Sorry, I'm kind of baiting.
Unless you went to med school and did a residency and know everything, you're not the surgeon. So my recommendation is from a patient perspective, to know what your goal is. What do you want in terms of what are you hoping to achieve? Mm-hmm. And then allow the surgeon in a conversation with you to develop a customized plan for you. Because what worked for your best friend may not work for you. And there are a lot of people out there who are very famous who have had cosmetic surgery and been open about it. And they obviously did not go along with the real buzzwords. You know, we have Simone Biles, who actually had a sub-muscular breast augmentation. She did not do a quote unquote preservation type of technique.
Just didn't fit her goals.
Didn't fit what she wanted or what was going to be good for her body. And it was, I mean, she and her surgeon made a video about it that I saw on social, but it was obviously a conversation they had to discuss her goals.
What would be your recommendations when you're like, okay, so if a preservation breast aug, who would that not be right for if their priorities were?
So let's talk about breast augmentation's complicated. Let's talk about a couple of things.
Okay.
You can do a traditional breast augmentation and put the implant under the muscle. You can put the implant underneath the fascia, which is a layer of tissue above your muscle, but underneath the breast. And that does not violate the pec muscle. Or you can put the implant right underneath the breast gland. So those are the different planes for breast augmentation. The Preservé technique, which is the one developed by Motiva, is a subglandular technique where they make a small incision and basically use a device to bluntly dissect the breast and place an implant. And that works for small implants.
Okay.
With the traditional breast augmentation techniques, you can use relatively whatever size implant is appropriate for your body.
Okay.
But there are multiple considerations. You know, you could argue, well, underneath the muscle is better for mammograms. But then if you are really physically active, you may have movement of your implant. Or you could say that putting it on top of the muscle, you don't have movement of the implant, but it's not always good for mammograms. And you may be in a situation where you have to have other types of screening as well. So it's a plus and minus thing, which is why it's a discussion with your surgeon.
And everybody's pluses and minuses are different. So if you're one of those people who makes a list of pros and cons, right? It's not just, they're not even. If I'm like, I understand that it's going to interfere with the imaging on my mammogram and I might have to have more screening to detect for that. Well, if I don't have a history of breast cancer in my family, or I'm not really worried about that, other people have a much higher anxiety. So that's going to be a bigger priority on their list, is making sure their mammogram screening is fuller. Whereas that's, you know, and
that's true. And other people who like to work out a lot, or they don't like the movement of the implant, that may mean, you know, that they don't want it underneath the muscle. So it's an individualized approach.
It's so individualized. And how does that kind of conversation authentically happen with you and a patient?
So when I first see a patient, I basically ask them to tell me about themselves. I want to know what your goals are. What are you hoping for? And then I do ask them if they like to work out, what bothers them. And I explain the pros and cons.
Do you feel like it's hard when patients do have their friend or their sister who's had a surgery, they come in, this is what I want? Is it hard to kind of pull them away from being like married to that idea and understanding that they're their own body?
It can be, but I'm going to be honest, you do such a good job of explaining to them that I prefer an individualized approach, that by the time I walk in, that's kind of what they're expecting, is that I'm going to listen to them and develop a plan based on what they tell me.
Yeah, because I mean, that should make them feel more special. Your body, everybody's body is so unique. Every woman's breast footprint is unique. Every woman's priorities are unique. So we're not very, it doesn't fit. It's not like if I drove your car, I'm like, oh, I love how this drives. And I think that I like where all the buttons and the nav system, I'm just going to go get this car.
Yeah,
it's not the same. We have such different.
You wouldn't be able to ride my bike.
I would look like I belong in a circus. That's where my knees would be like up to that would be a fun time though.
Yeah.
You would not be able to ride my bike.
No, I wouldn't be able to get my feet to the pedals.
And I love that about the approach that you take. I do try to prepare women when they call, and men. We do lots of surgeries on men. That it's going to be a collaborative conversation.
Yes, it has to be. Otherwise, we don't have an open line of communication. Yeah. We have to have an open line of communication.
And that you make recommendations based off of their goals that they're giving you. Sometimes those goals change even after they leave the office, which is interesting.
I know.
They'll come up like, actually, it turns out this is not as important or whatever. Yeah. I feel like we're going to get in trouble because we haven't been talking about marketing gimmicks.
Yeah, but we talked about breast augmentation.
The episode on marketing gimmicks.
That'll be next time, so you'll have to stay tuned.
We're never going to make it. Our podcasts meander a little bit, but most of the time they're still about boobs. And I feel like that's just going to get the right? I mean, if you always just always circle back to boobs, and then they'll keep coming back. That's the SEO. Thanks for joining us for this episode about lots of different topics, mostly about boobs. And join us next time for another episode where we just meander and run off on tangents.
Exactly. Have a great day.